I'm Nurul Ahad. I'm an orthopaedic surgeon, and that's how I started at Ilford Practice Plus. I am also now a medical director here, so my job is 50-50. In terms of orthopaedics, as an orthopaedic consultant, my main specialty is joint replacements, so hips and knee replacements. Patients often come when they're restricted either by pain or stiffness, when it affects their quality of life and doing their day-to-day activities. That's when they present themselves, and that can vary from different age groups. So you can have very young arthritic hip due to problems when they've had as a childhood or trauma. That can cause early onset arthritis. So the range of patients we see can vary from very young with similar type of arthritic joints as well as the very elderly. They don't usually come here presenting with pain. What they will say is, I can't walk the dog, or I can't do my gardening, or I'm having difficulty managing stairs, or difficulty in sleeping. Pain is something they get used to. It's that restriction, what they cannot do, is the reason why they might go to their GP, and the GP will refer the patients to us. Often not, I find that pain can be managed, but the biggest problem is the stiffness. Difficulty sitting down, difficulty getting out from a couch or doing your shoelace are common presentations that patients come up with. So whenever I see a patient, I always say, your end goal is to see if you can avoid surgery. Do everything to avoid surgery, because surgery is major procedure. However, if you've tried everything, then surgery is the right option for you. Every patient has different expectations, and it's based on their beliefs and based on people they've seen previously who've had surgery, or friends or family who've had either good or bad experience. So there's always a preconceived idea based on their own experiences. I always break down surgery into three parts: what they're expecting out of the surgery, what's going to happen on the day, and what the pathway looks like after surgery over the next 6 to 9 months. And I think it's very important that the patients understand that, but they understand it in their own language. First of all, understand their expectations first and see if we can meet it, and then how long it will take to get to that point. So I try to simplify it as best as I can. Hip and knee replacement has been around for about 60, 70 years. When it first started, surgery meant you would have to stay in hospital for nearly 2 months, 8 weeks. And that slowly changed down to 2 weeks. And more recently, over the last 5 years, we're talking about 2 to 3 days. We've got to a program which is called Enhanced Recovery Pathway, where we really focus on the pathway in each segment. So managing pain, getting them to mobilize early, the surgery itself, how we decrease the chance of infection and bleeding. We've got to a point where we can now successfully carry out a day case hip or knee replacement, which means that you've had the surgery on the same day. We can meet all the safe criteria of discharge on the same day as your surgery, as opposed to day 1 or day 2. And that works really well. We've been doing this at Practice Plus, particularly in Ilford, for the past 3 or 4 years. The trauma of surgery is not just the physical side, it's the psychological side. And the quicker you can get patients back to their normal routine activity, back to their own bed, back to their own environment, is very good for them psychologically, as well as there's strong evidence that the quicker you leave a hospital environment, the risk of things like infection or clots developing also dramatically decrease. So there's good science both for the physical benefits of being discharged on the same day, and psychologically you feel better. One of the great things we like to shout about locally is that patients have access in any direction they choose to go. So whether they go to their local hospital, where we still have a pathway they can come back into our treatment hospital, it's an elective hub, so we don't have the same constraints as the local trust in terms of emergency hospitals and cancellations. So yes, they can access us through here, they can access us through their GP, or if they go for an MSK where the GPs refer to physiotherapists first, the physiotherapists can direct patients to us. So we've almost reached out to the community. If they need us, we're here for them.